In this video, we'll discuss about odontoma. So, the first thing that you need to know about odontomes is that it is the most common odontogenic tumor. So, if we see ameloblastoma, it is the second most common odontogenic tumor. Now, coming on to definition, what actually is odontoma? So, odontoma is basically a hematoma of odontogenic origin, which is characterized by proliferation of mesenchymal and ectodermal cells, also leading with enamel and dentine being laid down in abnormal proportion. So, what do I mean by this? Now, a very important thing to remember. It is basically an hematoma. Now, what happens is the ectodermal and mesenchymal components are formed, but they are good in quality, but they are formed in abnormal proportions. Kabhi enamel will be more, or sometimes the dentine will be more. So, that is what an odontoma is. Now, you must remember the types. Now, in types, first of all, we'll talk about the invaginated odontome, evaginated odontome, enamel pearl. Now, in the invaginated, it is also the dense invaginatus, right? I have made a video on this topic as well. You can go and watch it. Invaginatus. Then, even the geminated odontome. Then what we have to discuss is the composite odontome. Now, composite odontome is further of two types. One is the compound odontome and the second one is the complex odontome. Now, I will tell you the basic difference between both of them. Now, in the compound odontome, what we usually see is that the enamel and dentine, they are laid down. One of them is laid down in an abnormal proportion. Now, yeah, the very characteristic feature of composite I forgot to tell you is that out of both, only one of the tissue, it will be laid down in abnormal proportions. Okay. Now, in a compound, what happens is there is resemblance to the normal tooth structure, but in complex, what we see is it is not having any resemblance to the normal tooth structure and not even to the rudimentary tooth. All right, now we will discuss the etiology. Now, in etiology, what usually happens is either there is some trauma or there is some pathology due to which there is an abnormal or uncontrolled or abnormal communication between the mesenchymal and ectodermal components. Now, due to this, the sole characteristic, that is the abnormal proportion of the tissues being laid down, is happening. Now, coming on to the epidemiology. In epidemiology, first of all, we'll discuss about age. It is usually seen in the second decade of life, and the average age at which it occurs is around 14.8 years or 14.7. So, in the sex predilection, it is usually not mentioned in case of odontome, but what we see in some studies, it was seen that it is more in males. Then, coming on to the site. Now, site is very important to know. Now, what is the problem is that both are different. So, they both occur in at different sites more commonly. So, in the compound odontome and complex. Now, I just want to mention one more thing. If there is compound, you must write it as compound composite odontome and not as just compound odontome for further specification. Now, the compound odontome, it is usually seen in the anterior mandible, and complex is seen in the posterior mandible. Now, how you can remember this is, suppose there's a pathology which is occurring in the posterior part, so it is very difficult to get into it. Whereas in the anterior, you can just do it. This is just for learning purpose. So posterior, it is going to be a complex process, so just remember it this way. All right. Yeah. So also we have this. Also, this is anterior maxilla. Sorry. Yeah. All right. Now coming on to the clinical presentation. Now in the clinical presentation, what we see is it is generally asymptomatic. Then it is basically seen on general examination. On general routine examination, usually there is an unerupted tooth, due to which we get to observe such a pathology, unerupted tooth. So it is usually associated with unerupted deciduous impacted tooth. All right. Also, what you will see is swelling, and there is going to be evidence of infection. It usually causes the expansion of bone, which is manifested as facial symmetry. All right. Now coming on to the histopathology. Now in the histopathology, it is not a diagnostic criteria. It is composed of normal dentine, enamel, cementum, and pulp. Now, what happens is the mature enamel, it is lost during calcification and decalcification and processing, due to which it will not seen on the conventional H&E stained slide. Now, sometimes you also get to see coast cells in odontomes. Then there is one more thing, that the dentinal tubules, they lie in contact direct contact with pulp, with connective tissue. So basically, it gives a appearance of a normal pulp. Also, the lesion, it is surrounded by fibrous capsule. All right, so this is it. Now we'll just draw some diagrams so that you can draw it in the exam as well. So first I'll be drawing the compound odontome. So this is going to be compound, composite odontome. This is going to be complex composite odontome. All right, now let's do the labeling. Can't find my pencil. So this is the enamel space. Then this is the dentine, pulp, connective tissue, stroma. All right, now let's draw the complex odontome. Just let me highlight it. Yeah, so complex odontome. Now complex odontome, I don't know how to make it physical. Yeah, right. So this is the dentine. This is the fibroblast. Forgot to draw one thing. This is the cementum. Then blood vessel, collagen fiber, and enamel space. I'll just keep it for some time here so that you can screenshot. Yeah, so this is the diagram. All right, now we will do the radiographic features. Now radiographic features are very important. You know why? Because there are two keywords in it. So let me tell you. The first one is we are discussing about the compound odontome first, and then complex. Now in compound odontome, what you usually see is you see bag of teeth. Okay, now there are some tooth-like structures that are seen, and they resemble the tooth. So it actually looks like it is a bag of teeth. All right. So it is, yeah. So this, and but in complex odontom, what you must remember is a sunburst-like appearance and a conglomerated mass. Now, in this, what happens is there is a conglomerated mass of calcified tissue with radiodensity, all right, of the tooth structure. And it is also very important to remember this point, that it is surrounded by a radiolucent layer or a radiolucent reaction. So what you will see is, basically, suppose this is the tooth that you are able to see, then what you will see is there is this radiodense mass. Okay, this is an uninterrupted tooth. So all right, then what you will see is, फिर से radio density will increase. Here it is radiodense, here it is a radiolucent reaction. So this is what you must remember. And the sunburst like appearance, very important point. Now in the treatment is usually excision. You will have to surgically remove it, surgical removal, especially in the cases of periodontal abscess, impinging eruption, where there is no expectancy of the recurrence. So I hope I made this topic easier for you to understand. And I know my drawing is not that good, but yeah, I tried. So if you like the video, give it a like, comment, and subscribe to my channel, and also share it with your friends. Thank you.